Cases and mortality due to dengue have reportedly decreased from 2019 to 2021. And this was confirmed by the Health Department during today's media briefing. Jen Calimon is reporting to us live from Malabon to give us more details on this. Good morning, Jen. Why did dengue cases in the country decline since 2019? What are they attributing this to?
Yes, Charles. Dr. Eileen Espiritu of the Disease Prevention and Control Bureau of the Department of Health confirmed that the cases and mortality due to dengue have significantly decreased from 2019 to 2021. The DOH is attributing this development in the enhanced implementation of their 4S strategies to fight dengue. And she also mentioned that the restrictions of movement due to COVID-19 pandemic has also contributed to the decrease in cases. Aside from this, Charles, one big factor in decreasing this number is the participation of the public in ensuring that water sanitation and hygiene protocols would still be followed. Charles?
Right, Jen, could you break the numbers down for us? How many dengue cases are we talking about, and how many mortalities were reported in that same period?
Yes, Charles. So from 2019 to 2021, the morbidity rate was or has reduced by 25%. So 437,000 cases were reported in 2019, 83,000 in 2020, and from January to April 17 this year, the morbidity rate has increased or has decreased rather to 21,000 cases. Now, in terms of mortality, the rate has reduced by 50%. So in 2019, we have more than 1,600 deaths. It dropped to 324 deaths in 2020, and it further went down to 80 deaths from January to April this 2021. Charles?
Right, Jen, you mentioned earlier some of the things that have been working to prevent dengue. So could you tell us more about the strategies that are being implemented by the DOH currently?
Yes, Charles. Because of the emergence of COVID-19 pandemic in the country, the DOH has also intensified their fight against dengue. They have utilized digital platforms to distribute advisories to the Centers of Health Development for guidance and requested actions. They also shifted to virtual program implementation reviews with Centers for Health Development, where they call offices to discuss policies, directions, and operational strategies. Aside from this, Charles, the DOH has also engaged information, communication, and education campaign materials disseminated in radio, TV, newspaper, and internet. Charles?
We do know that the dengue virus comes from mosquito bites, but then in relation to this coronavirus pandemic, I understand there's some clarification here as to whether it can be transmitted to other people via mosquito bite as well. What did they have to say?
No, Charles, that's a big myth. COVID-19 cannot be transmitted or carried by a mosquito because coronavirus is a respiratory disease which can be transmitted through droplets. Also, Charles, mosquitoes can only carry illnesses such as dengue, malaria, Zika, and chikungunya, among others. Charles?
All right, myth debunked. Thanks for that, Jen. Any reminders given by the DOH to prevent to the public to prevent dengue infections?
The DOH warns that cases of dengue might increase this rainy season, thus the need to follow the 4S against dengue. So these are searching and destroying mosquito breeding sites, seeking early consultation if a person experiences fever of 2 days duration and rashes came out, doing self-protection measures such as wearing long pants and long sleeve shirts and application of mosquito repellents, and also supporting fogging or spraying in hotspot areas. Charles?
Thanks for that, Jen. That was Jen Calimon reporting live from Malabon.